Welcome to San Diego Made, San Diego Proud. I'm Allie Wagner. We are celebrating business members who have helped define San Diego as America's finest city. And with me this morning is Alleyne from Tri-City Medical. Welcome.
Welcome, Allie. Very nice to be here.
Now, you're talking robotics today. Tell me about how, the technology has got to be a lot different than what it used to be.
Absolutely. In 1989 and in the mid-80s, we started using pedicle screws for the first time in spine surgery. It evolved, and the accuracy now with the robot is unprecedented. We're able to now place these screws with incredible accuracy in the spine in the cases of deformity like scoliosis,
right,
or in patients where their bones are not quite aligned well. And the accuracy is about 99% with this robotic guidance system known as Mazor Renaissance Robotics.
Wow, 99%. Now, I know that we have a preoperative video. Tell me about how all this works.
Correct. Prior to the Renaissance, we would have to take multiple x-rays intra-op. This is a video looking at doing these screws preoperatively.
Yeah.
So a day before, a week before, we can actually place these screws into the spine and see what the alignment is going to be like and what the diameter of the screw should be. And you can see here how we can actually tilt and move that screw to get the perfect placement of that screw in the vertebra.
Wow, that seems like it's an exact science now as opposed to guessing.
Absolutely, Allie. And what you're looking at here, I can dial and tune that alignment of the screw specifically within that vertebra. And this is a magnification now, looking at the spinal canal. You can see how close we are. That black structure in the middle is where the spinal cord is.
Right.
And movement of the screw to the right would result in that being breached and causing significant neurologic damage.
Wow, so now this way it's a little bit easier to do. Now, I know we also have an operative video as well to kind of show what happens when you're in surgery, right?
That is correct. And intraoperatively, we place this mount onto the spine, and there's a picture taken in what we call an AP and an oblique fashion. Once we take these two x-rays,
yeah,
the entire x-ray machine can be moved out of the room, and these screws can be placed absolutely perfectly within each vertebra. And what you're looking at here is those two views taken, and where the CT now is mapped to that to look for the accuracy in that particular vertebral body for placing the screw. Prior to this, we would have to take multiple x-rays,
right,
exposing the patient to a lot of radiation and the people in the room to a lot of radiation. Now, just two x-rays are taken, the x-ray machine can be moved out of the room, and you can now place those screws with incredible accuracy.
Real quick, tell me what kind of surgeries can be done with this robotics?
About 500,000 surgeries are done a year, which we call spinal fusions.
Yeah.
So when we look at that, all of those cases, anything from the lower cervical area, which is the neck, to the thoracic spine, which is your mid-back, to the lower back, lumbar spine, and sacrum, which is your pelvis, can be used with this incredible technology that we have at Tri-City Medical Center.
And real quick, how can people get in touch with you?
www.tricitymed.org, and we would be glad to see if you're a candidate for this and be able to show you that technology.
Well, thank you so much. That seems incredible. Thank you so much for sharing this information. We appreciate it.
Absolutely. Thank you.
That's going to do it for San Diego Made, San Diego Proud for today. We will see you guys next time.